Greetings! I am Professor ODR, and today I will be discussing the Foot Posture Index, also known as the FPI. The FPI is a clinical tool to assess a foot type, be it pronated, neutral, or supinated. It is a very simple, efficient, yet effective tool. In the assessment of the foot, we will be using a 6-step process using 3 different views of the foot. Also, we will be using a 5-point numerical scale, going from a -2 being more pronated to a +2 being more supinated. So why do we do these measurements? Well, a finding in a research report from July of 2011 in the Orthopedic and Physical Therapy journal, there was found to be a higher risk of injury, especially in athletes with a more supinated foot compared to the pronated or neutral position. Also in this research, with extreme pronation, it was also associated with chronic heel pain, and as well in extreme numbers of negatives and positives with knee and hip osteoarthritis. Along with the association of injuries of the lower extremity, this can also be a very good preventative measure to keep from injuries happening. The National Center for Injury Prevention and Control has estimated over 10,000 Americans yearly have injuries just from recreational, running, playing sports, exercising, and over 50 to 80% of these are lower extremity injuries. This procedure only takes a few minutes, and the only tools you will need are your eyes, your fingers to palpate, and of course, the foot. So now that we know the what and the why for the FPI, let's move on to the how. First, you will position the patient on an elevated surface, bearing weight on both feet, which are parallel to each other. Have the patient look straight forward, hands to the sides, and no twisting or bending. Let the patient know this test will only take about 2 minutes. Now that we have the patient in position, let's start with step 1. In the first step will be the talus-head palpation of the foot. The talus head is palpated from the front of the patient to determine the prominence on the lateral versus the medial side of the foot, with a -2 indicating palatable only on the lateral side and a +2 palatable only on the medial side. Second step is viewing the superlateral and infralateral malleolar curvature of the foot. The curvature below the lateral malleolus is compared to the curvature above the lateral malleolus and scored based on the extent of the concavity. A -2 indicating no concavity below, and a +2 indicating more concavity below than above the malleolus. Third step, the calcaneal-frontoplane position. Calcaneal position in the frontoplane is assessed from the rear of the patient and scored a -2 indicating greater than 5 degrees estimated inversion, and a +2 indicating a greater than 5 degree estimated eversion. Fourth step, the prominence of the talon-avicular joint. Prominence in the region of the talon-avicular joint is assessed from the rear of the patient and scores a -2 indicating marked concavity and a +2 indicating marked convexity. Fifth step, the congruence of the medial longitudinal arch. The medial longitudinal arch is assessed from the medial side of the patient and scores a -2, meaning a very high arch with a steeper lower, and a +2 indicating a low arch contacting the ground like a flat foot. Sixth and final step, the abduction and adduction of the forefoot on the rear foot. Abduction and adduction of the forefoot on the rear foot is observed from the rear of the patient and scores a -2 indicating medial but no lateral toes visible, and a +2 indicating lateral but no medial toes visible. Now that we have all the numbers, what do they mean? If you have a -12 to a -5, it would be highly supinated. A -1 to a -4 is supinated. A 0 to a +5 is neutral. A +6 to a +9 is pronated. And a +10 to a +12 is highly pronated. Well, I hope that you have enjoyed this presentation of the FPI, the Foot Posture Index, as well as I have. Again, my colleague here will take over in handing out the grading sheet and the assessment tool to help you do this procedure yourself. I bid you adieu and see you next time. Thank you. Goodness gracious. Who's in snaggle? Who? Somebody needs some deodorant. Yeah. Welcome back. You put that on camera? You have to make sure the foot posture index is a very accurate way of doing it. You see, it's a very simple 6-step process, and that you a very simple 6-step process which you can do effectively and efficiently with the patient in any circumstance. And this little piggy stay home. And this little piggy, from pediatrics to geriatrics, I saw you. I got you. Yeah, I got you. Yeah.